order to figure out what to teach first, you have to know what skills they're coming to you with. So you have to have some sort of assessment that's been done, and that can be done by looking at old records and different assessments that people have done recently. Make sure it's not a few years ago. And they need to do this across several areas of functioning. It shouldn't just be like an IQ test or something that provides you with raw scores but doesn't provide you with actual skill levels or like numbers that go with skills that you can actually identify. And so that's where I always start, is I start with looking at the results of an assessment to tell me what are the weaknesses, what are the strengths, and then we go from there.
And so for a parent, if a parent's going to be setting up or being a part of designing a program or teaching it themselves, there aren't that many choices for us. You can go to a professional and ask for an assessment. As you said, we can look at the back things. One of the things I recommend, though, is the skills assessment. I find that it's really effective. There have been studies to show that it's very accurate in seeing where a child is. So easy enough to say and do, but it's kind of exhaustive. And it can be exhausting for a parent to do that assessment. But, talk to us a little bit about how worthwhile it is, to have that snapshot.
Right. Well, first of all, I just want to mention that skills assessment doesn't have to be exhausting if you do it in a certain way. So if you have a younger child who's just starting out, all of the assessment questions are categorized by kind of the topic you're being assessed in and by levels, and the levels go from 1 to 12, with 1 being the most beginner level and 12 being the most advanced. So you can start by answering assessment questions at level 1, and if your child is already at the point where you're saying that they can't do certain things in level 1, then you might be okay to just stop with level 1 lessons, which means you don't have to overwhelm yourself with continuing to assess further, because it's kind of like we talk about this in assessment as like a basal and a ceiling or something like that. So you're getting an idea of like, okay, well, we've already reached a ceiling here. We don't need to keep on assessing.
Okay. Because obviously the lessons progress with both skill and age. And so if you know that the child isn't able, to count to 10, then we don't need to answer questions about whether they can add numbers. Because obviously if you can't count to 10, you can't add numbers. So you can stop there.
And the skills assessment is linked. So like if you would need to know one skill to do another, it won't ask you those questions a lot of times. But still, because of prerequisites, you wouldn't move on to other skills a lot of times until you have the prerequisite ones in place. So there is no need to continue to answer more and more questions as you go up the levels of difficulty, right? You want to work on the easier things first.
Great.
So that's that's one way to do it. Now, if you have a child who's really advanced and you're saying, yes, they can do this, yes, they can do this, you're sitting there a lot longer answering questions. But there is another strategy that you could use, which is when you open up each of the questions for a particular area, instead of starting with the first question, which is always going to be the easiest, you could start at the bottom and you could work your way back and see if they know it all. And if they do, you could probably quickly answer the whole thing as a yes. You know what I'm saying?
Yes, I do. And I think that's important because we've had many people write in and say, I'm starting with my child at 14. This is a much more common thing with insurance and with diagnosis being better. My child's 14, I'm starting services, and I'm looking at skills, and I don't know what this has to do with me, and I don't want to spend all this time answering these questions because it seems like they're baby questions.
Here's another thing I want to mention. So I have a couple of clients that are between the ages of 14 and 16, and when I got their skills assessment all filled out, and they did take the time to answer all the questions, what I found was their language was normal, their motor skills were normal, their self-care skills were normal. Where they were lacking was in social skills, executive functions, and perspective taking. And so if you have a kid that those are the issues, like let's say you just pretty much know your child is just going to need help with social skills, or they're just going to need help with all 3 of the areas I just said, then don't bother answering any of the assessment questions for the other curricula because you are not interested in that.
Yeah. So focus on those other ones first. I think sometimes the funding provider or the provider is asking them to make sure that they answer all of them. But if you know that your child, as you said, if you start with the bottom question and you know that they can do that, then all it is click yes, 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 yes. And it doesn't have to be this big ordeal that it needs to be.
Exactly.
So important, though, because if we if we're not effective at where we start teaching, if we start too far along and we don't have the prerequisites, then we're not going to get to progress easily. We're going to keep feeling like we're hitting our heads against a wall. But if we waste time on something that isn't what's key, we're going to waste time that way too. So having that snapshot and knowing, okay, this is where we are, helps you to know. And the other thing that I like about skills is it not only shows you where you are, but it shows you where you need to get to.
Right.
You see on a bar graph. I'm a visual person. I like a visual. You see on a bar graph, this is where my child is on this particular skill, and this is where they should be at this milestone for where they are age-wise, and this is how much I have to make up.
Yeah.
And then you can watch it inch up closer, which is a very exciting thing for me.
Cool.
I really, really like that.